Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Angina represents more than just chest pain. It serves as a crucial indicator of potential issues within the cardiovascular system. Understanding the nature of angina provides valuable insight into the intricate mechanisms of heart health, emphasizing the significance of both lifestyle choices and genetic predispositions in maintaining cardiac well being. Each instance of discomfort in the chest serves as a poignant narrative that demands our attention. It is imperative that we acknowledge and address these warning signs as they offer invaluable information about the state of our hearts. So let us gain a deeper understanding of the complexities inherent in cardiovascular health, ultimately empowering us to make informed decisions for the benefit of our well-being. Welcome everyone. I'm Dr. Saurabh from THIP Media, and we're privileged to be accompanied by a distinguished cardiac expert, Dr. Saurabh Chopra, who will guide us through the complexities of angina, a topic of utmost importance. Dr. Saurabh Chopra, an acclaimed cardiologist, stands as a beacon of excellence in the fields of clinical, preventive, and interventional cardiology. Dr. Chopra currently works as a consultant interventional cardiologist with Narayana Health. With extensive experience spanning numerous years, Dr. Chopra has become a leading authority in cardiac healthcare. Dr. Chopra's notable contributions encompass advancements in heart failure management, intricate angioplasty procedures, and proficient pacemaker and device management. Renowned for his holistic approach to cardiac care, Sir emphasizes personalized treatment strategies tailored to each patient's unique needs. Dr. Chopra's commitment to excellence is evident in his unwavering dedication to providing exceptional care and improving patient outcomes. His patients benefit not only from his clinical expertise, but also from his compassionate and patient-centric approach to healthcare delivery. Sir's reputation as a trusted cardiologist underscores his unwavering commitment to advancing cardiovascular medicine and ensuring the well-being of his patients. Dr. Saurabh Chopra, THIP Media welcomes you, sir.
Thank you. Thank you for welcoming me here.
Thank you so much for being with us today, sir. Sir, we're all aware that chest pain is a very crucial yet often ignored indication of cardiac issues. So I'm going to start this discussion with the most fundamental question that what exactly is angina and how does it affect the heart's functioning?
Angina is a classical angina is defined as a chest pain which is diffuse in nature and gripping in sensation. A patient feels gripping chest pain and it is most likely a cardiac origin pain and it worsens with exertion. It is associated with sweating, anxiety, ghabrahat. Patient define it as ghabrahat, and it worsens with exertion and it comes down with rest. Also relieves with a lot of medications like sublingual nitrates help in relief angina, antiplatelets help. So angina, we use the word angina when it is related to a pain which is cardiac in origin. And there are a lot of other causes which are less of lesser significance, but people misdiagnose it as angina or give it less relevance and it is ignored often, and that can be catastrophic. So understanding whether it's a cardiac origin chest pain or angina or it's a non-cardiac origin pain is of paramount importance.
Okay. So like you just mentioned that the primary symptom of angina, usually what the patient defines as ghabrahat, right? So it can be associated with a lot of other health conditions. And a lot of people, they may ignore these mild chest pains thinking that, it could be gaseous in nature, could be because of fatigue or just nothing at all. So at what stage should someone become aware of the severity of this condition?
So, a fleeting pain, transient, localized, might not be angina. Generally, angina would last longer. A
Okay.
chest pain which is persisting for more than 5 minutes, moderate to severe in intensity, and is associated with sweating.
Okay.
That should sort of ring the bell that this is not a gastric discomfort. This at least needs a basic evaluation in the form of a electrocardiogram, and then we can at least our ECG would help us rule it out. Just doing a basic evaluation in the form of an ECG would help us distinguish whether it's a cardiac origin angina or a non-cardiac chest pain. So
Okay.
I would say that if pain is persisting, associated with sweating, घबराहट, and there's a past history is also involved. If the patient has a prior history of a cardiac illness, patient has any of the cardiovascular risk factors like diabetes, hypertension, or has been a smoker, or a family history of cardiac ailments is there, then he should be particularly alarmed that you should not ignore the pain as a gastric discomfort and do a basic evaluation in the form of an ECG, echocardiogram, or a cardiac enzyme, and rule out whether it's a cardiac origin pain or a non-cardiac pain. So, if that is ruled out, then we can be relaxed that okay, this is a gastric discomfort. But without that basic workup, it's very difficult for a layperson to predict that it's okay, this pain can be ignored. So, if you have that characteristic chest pain, which is lasting long, more than 5 minutes, associated with sweating, and those risk factors are there, then you should get it evaluated.
Okay.
As soon as possible.
Okay. And how can someone actually understand what angina pain is, especially the part when it initiates a heart attack? Because patients often do not recognize these symptoms well.
So, because there are so many confounding factors and so many pains which are similar to a cardiac pain,
Yes.
I understand where the question is arising from. But generally, that is why again and again I would reiterate what is a cardiac chest pain? A pain which is diffuse in nature. Patient describes it as a diffuse substernal pain beneath the chest. He describes it like a gripping sensation beneath the chest. Some people describe it as a weight on the chest, which is associated with other symptoms like sweating and घबराहट. And it will always worsen with exercise. Patient will say that I can walk a few distance and then I have to stop. That is an anginal pain. Suppose a lot of patients come to us with a non-cardiac pain. They are generally well localized. Patient will point with a finger that this is my pain.
Right.
Those are generally we find that on evaluation they turn out to be a non-cardiac in origin.
Okay. And since evaluation in this case is very important, particularly by a professional cardiologist yourself, how would this diagnosis play a role in distinguishing between, let's say, stable and unstable angina?
So, sorry, I couldn't get the last part. How would the evaluation?
Yeah, so you've just mentioned that the evaluation of the condition by a professional cardiologist is extremely important in the diagnosis of angina. So, what part does this detection or diagnosis play in the distinction between stable and unstable angina?
So, see, detection is crucial because it can be a matter difference between life and death.
Right.
In the form of angina, could be an acute coronary syndrome. It could be because of a blockage in the coronary artery, which could be a total blockage or a near total blockage. So, if we find some changes on the ECG, electrocardiogram, or on the echocardiogram, or on a cardiac enzyme, and we decide that it's a cardiac chest pain, then we decide to do a cardiac catheterization or angiography and find out that blockage and treat it as soon as possible. Because in cardiac pains, we find that the time is muscle. If patient has a occlusion in one of the coronary arteries, and he doesn't get it addressed in time, then you start losing out on muscle. Uh, Cardiac muscle, if once dead, it cannot be recovered. Then patient will always have features of heart failure. He'll be breathless after walking a few steps for the rest of his life, and he has to be
Okay.
on a lot of medications for that. So
Okay.
time is crucial. So if we do not find the diagnosis, and we just keep on ignoring as a gastric discomfort, then it can be catastrophic to be. And if we just find out that it is normal, the basic evaluation is normal, then we can sit on it, relax, and get other workup done, whether it's a gastric pain or muscular pain, and find out the cause of discomfort. But for if it's a cardiac one, that patient would benefit a lot from treatment, and the implications can be lifelong,
Okay.
as I just
Right.
described.
Right. And you've already mentioned a couple of medications that you would actually prescribe to a patient diagnosed with angina. So just re-emphasizing on the same point, could you help us understand the medications that you would typically prescribe to alleviate the angina symptoms?
Yes, I would certainly do that. A lot of patients are on anti-angina medications like nitrates, sublingual nitrates, or long-acting nitrates, which help relieve angina. Then we are having a lot of medications like antiplatelets, which help restore the blood flow to the coronary arteries. And suppose we have to undergo subject the patient to a angioplasty, then to keep the stent in a good condition, keep the blood flow within a stent within a normal condition, fluid state, we have to give blood thinners like aspirin, clopidogrel. Nowadays, newer drugs have come in like prasugrel and ticagrelor. So they are
Okay.
all blood thinners, and depending upon the severity of blockages, we have to decide whether patient requires one blood thinner or two blood thinners, and thereon. Then,
Okay.
apart from that, patient has to be on statins to
Okay.
prevent a cholesterol plaque from worsening or formation of progression of the plaque. We have to prescribe the patient on statins. If the patient cannot tolerate statins for some reason, then there are alternatives to that also available now. Then there are beta blockers.
Okay.
They help reduce angina, and also a lot of other secondary medications are available like ranolazine, trimetazidine, and nicorandil that help in relieving angina. So,
Okay.
depending upon the severity of blockages and the severity of symptoms and other risk factors, we decide whether a patient requires which of these medications.
Okay. Right. And another important thing is that once patient is on medication, is it really important for angina patients to regularly monitor their heart health, particularly, and I'm talking about in context with the warning signs that they should always be vigilant for?
Sorry, last again, you were talking in context with?
I'm repeating the question. I'm asking that patients who are on, medications, the ones who have been diagnosed with angina, they are on medications. So, how important is it for them to regularly monitor their heart health? I'm talking in context with the warning signs that they should always be vigilant for.
Yeah, warning signs. See, all of these medications that I just described, they have their own side effects.
Okay.
So that's why we request follow-up visits. The purpose is to monitor the side effects, because blood thinners can cause a patient to have a bleeding, which can be a minor bleeding, can be ignored in context with his cardiac condition, or could be a major bleeding, and we might have to reduce the number of medications that we are giving to the patient, or
Right.
go from 2 to 1 or 1 to 0, depending upon the severity of bleeding. Bleeding
Right.
can happen in the gastrointestinal, in the intestines, or in the brain, which could be a major bleeding, and it
Okay.
could warrant us
Right.
to stop the medications if his cardiac condition allows,
Okay.
or reduce the number of medications. Similarly, statins have been reported to have patients report to have muscle weakness, from mild to moderate to severe in severity. So
Okay.
mild symptoms we can ask the patient to ignore. If the patient is having severe symptoms, then body aches, or he's having in his follow-up LFT, liver function test, the liver enzymes are elevated, or
Right.
he's having hematuria, then we ask the patient to stop statins, and we have to treat that condition. That is
Okay.
a severe form of rhabdomyolysis, has been reported in secondary to statins. Then
Okay.
nitroglycerins and beta blockers can cause the blood pressure to fall.
Right.
So we have to always, when we are going on to a polypharmacy, multiple drugs are going on. You have to see which of the medications is interacting with the other, causing a side effect, and alter the medication according to patient symptoms. So the
Okay.
role of follow-up visits is very crucial in defining which medication is suiting a patient, what are the interactions, cross interactions, side effects that are happening, or if the patient is receiving optimal treatment or not.
Right.
Also, it helps us ensure compliance, whether
Okay.
patient is compliant to medications or not. So
Okay.
all these factors come into control. And warning symptoms would be worsening of chest pain.
Right.
If they happen on medications, then it could warrant the need to do a check angiogram, or sweating, or if patient is having syncope, falling down,
Okay.
that could be a warning sign. The medications are sort of on the board. Third could be a bleeding in any form.
Okay.
If patient is having a GI bleeding in the form of blood in the stools, or patient is having severe headache and vomiting because of secondary to bleed in the brain. So the role of follow-up visits is crucial to just rule out any of these.
Okay. And I suppose that for a better quality of life for any heart patient, I suppose that lifestyle adjustments would play a very, very important role along with the medications, right? So, what lifestyle adjustments can individuals make to better manage angina symptoms?
Yes, you are very correct, ma'am. Lifestyle interventions, lifestyle changes are of paramount importance. Like I discussed in the first, the reasons are patients with cardiovascular risk factors like diabetes, hypertension, smoking. They are most likely to have a cardiac event, and the pain could be a cardiac one. So these are
Okay.
the modifiable risk factors. So if a patient is having a diabetes, we ask to adjust to a strict diet, especially tailored to a diabetic, and control his sugars, because diabetic patients, we have found the risk of cardiovascular events is 3 to 4 times as compared to other person of his age.
Right.
For a hypertensive patient, we recommend a low salt diet. For somebody who's smoking, we ask that smoking is to be strictly avoided.
Okay.
You have to ask the patient to incorporate a structured exercise regime as per his cardiac condition.
Right.
If the heart pumping is okay, then he can exercise regularly. If heart pumping is slow, then also we ask the patient to exercise, but we ask him according to his individualized cardiac condition. We have to take into factor his heart pumping, his age, and a lot of factors. So we do ask the patient to exercise so that his metabolic parameters can come under control. Also, lastly, and most importantly, the cholesterol. That can, we have seen people losing weight with exercise, and the cholesterol coming under control, and each of the other risk factors, diabetes and hypertension, coming into control. So exercise plays a key role. And cholesterol, for cholesterol, we ask the patient to take a low fat diet.
Okay.
So a lot of things are there in the lifestyle that we ask the patient to do, depending upon his specific individual needs.
Yeah, right. So personalized lifestyle adjustment is the key here. That's what I understand. Okay.
Yes.
And now this is just strictly in context with the emergency phases. Now, are there any herbal remedies that might be used in an emergency to relieve the symptoms of angina? Just emergency.
You have got me in a fix here. Being an allopathic practitioner, I am actually not able to name
Okay.
any herbal medication that I would be helpful. I would ask people to refrain from following any herbal treatment
Okay.
If it is a classical cardiac pain, angina, that wouldn't actually help. It would just probably delay in receiving treatment, the required treatment.
Okay.
Once we rule out it's a cardiac pain, then okay, you can follow herbal medications.
Okay.
But first step would be, if you have chest pain, get it evaluated, rule out a cardiac pain. If it's not a cardiac pain, you can follow herbal medications, and I would not prescribe them.
Okay.
So I would ask a specialist in herbal medications to prescribe, a homeopathic doctor or allopathic practitioner to prescribe it. But that
Because
would
what
be my advice. First, rule
Okay,
out a
then-
cardiac pain.
yeah, because I understand that cardiac pain usually, because people tend to ignore it so much, it usually manifests as an emergency condition. So
Yes.
the ideal thing should be that one should visit a cardiologist as soon as possible. That's what I
Yes.
read. Okay.
A
And now,
cardiologist, or preferably, if you're not able to, at least a medical practitioner, MD medicine doctor who can understand and read a ECG would
Okay.
would be of great benefit to a patient. ECG is a great tool.
Right. So the diagnosis at the right time can actually save lives.
Yes, a stitch in time saves 9.
Absolutely. So I'm just going to summarize the session. That can you offer guidance to patients diagnosed with angina that would assist them in upholding a high quality of life and also preventing complications linked to their condition?
Yes, as I previously again mentioned that it is of paramount importance to diagnose it in time, as time
Right.
is muscle. What all can happen is you could have a major heart attack if you do not diagnose it in time, and it could lead to reduced heart function, and you could have breathlessness all your life despite medications, and those medications have their own side effects. So you will
Right.
have to be on longer list of medications for the whole life if you don't diagnose it in time. So the number of medications would increase, comorbidity increases in the form of increase in symptoms like breathlessness, and even a major heart attack could lead to sudden cardiac death also. So it could be catastrophic. I'm again repeating, in the form of a death, which could be averted. So
Oh.
if you diagnose it in time, it could really help you out. And one of the things that I didn't mention was arrhythmias. The possibility is always there of arrhythmias.
Okay.
Heartbeat going very low or heartbeat going very fast.
Right.
And some of the other complications are like a rupture of the heart muscle, which can lead to death, which would lead to death, or tear in the walls, which could lead to breathlessness again. So
Okay.
the symptoms generally starts with angina and then worsens to breathlessness or palpitations. So if as early we diagnose it, we could prevent one of these complications from happening.
Okay. So that was very insightful, Dr. Saurabh. And we appreciate your presence with us today, sir.
Thank you, ma'am.
Uh,
Thank you.
Thank you, sir. And I'm hoping that the enlightening information shared will be valuable to many families out there. So
I hope so.
more such, yes. And for more such informative videos, please subscribe to our channel and press the bell icon for regular updates. Thank you once again, sir.
Thank you.
Thank you.